Today, the CDC estimates that 9.4%, or almost 1 in 10 of all US children, are diagnosed with ADHD, with the percentage of children diagnosed with ADHD significantly increasing over the decades. Teachers are normally the ones who tell parents there's a problem, often because these children are disruptive and teachers simply need a functional classroom. Parents then take their child to their pediatrician. Most children are diagnosed with ADHD and prescribed medication after a relatively quick consultation, simply in the hope that the medication will help. But although ADHD is a diagnosis, it's not a disease. ADHD is simply a description of difficulties and behaviors. According to the DSM, you can be diagnosed with ADHD if 6 out of 10 boxes describing behaviors or difficulties can be checked. Obviously, this is subjective, but even more importantly, before making the diagnosis, you need to make sure that there isn't another, better explanation for the issues. Changes in attention and poor behavior can be caused by an almost unlimited number of issues, ranging from sleep to poor diet, family, social and environmental issues, and other things such as learning disorders or anxiety. So here's the question. Is there a better way to diagnose ADHD? The answer lies in the nature of ADHD medication itself. Almost all medication for ADHD is based on different formulations of amphetamine, or speed. To understand how the ADHD medication works, imagine that the brain is attached to a dimmer switch. ADHD meds, which are based on amphetamine, increase the power of an underactive brain, normalizing activation and improving function. But here's the issue. What if the problem is not too little power, but too much? Unless you actually need to increase brain arousal, ADHD medication will increase brain activity way beyond where it's meant to be, making you anxious, irritable, and emotionally reactive. Surely, the goal of any medication affecting the brain, including ADHD medication, should be to normalize brain function. In effect, to turn the dimmer to normal so the brain can work in its most effective state. So, if we know how ADHD medication affects the brain, can we measure brain activity and then predict ADHD medication response? The answer is yes. Here at Grey Matters, we use a method of functional brain imaging called quantitative EEG. Quite simply, this measures brain activity and compares it to a huge database used by hospitals and doctors all over the world. This kind of testing, which is simple and non-invasive, shows whether the brain is underactive and would be improved with ADHD medication, or overactive and therefore made worse. As a final note, we've made tens of thousands of brain recordings. Most of the children that we've seen who were diagnosed with ADHD are dysregulated, but they have brains that show over-arousal and not the under-arousal that would be helped by ADHD medication, suggesting that ADHD medication is significantly overprescribed.